Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
You're looking at a few hundred cells here that are working together.
The heart muscle cells that Dr. Tim Nelson views highlight recent advances into regenerative medicine.
The simplest way to explain that is it's the opposite of degeneration.
Tissues in your heart, joints, and other areas can degenerate or break down with time or disease. Regeneration is the renewal of those tissues, which is something the body does naturally.
So one strategy is to try to find ways to improve the healing of your body, and another strategy is to actually supplement or augment the stem cells in your body so that we can improve the healing by transplanting stem cells into it.
Dr. Nelson and his colleague Dr. Andre Terzik use stem cells in their research because stem cells are responsible for growing new tissue.
So stem cells just means that they're seeds that can grow into many, many tissues.
Stem cells can come from a variety of places: embryos, which are not generally used anymore, umbilical cord blood, or adult bone marrow.
So the type of stem cell will dictate how many different types of tissues can emerge out of it.
Scientists can engineer stem cells into the type of cells they want. Here's how it works. Cells called fibroblasts are removed from a patient's skin. They're reprogrammed into what are called pluripotent stem cells. Those cells can be taught to become any type of healthy cells, such as these heart muscle cells. The idea is that the newly engineered healthy cells, when introduced to, say, those of a failing heart, will help restore or regenerate the function of the unhealthy cell.
This is one cell that's contracting, is working with many cells, and that gives the whole tissue the contraction pattern like a normal heart.
It becomes much more real when you have a personal connection to a disease or an illness where we don't currently have good options. And this is where people are asking more and more of the questions, what about stem cells?
The answer is researchers such as these at Mayo Clinic push forward to make regenerative medicine a reality for patients searching for successful treatment and perhaps cures. For Mayo Clinic News Network, I'm Vivian Williams.
In 1969, 2 weeks before they walked on the moon, I was diagnosed with colon cancer.
Since then, Keith Warner has fought cancer a total of 4 times, all because of a gene that runs in his family.
Our family has a long history of cancer.
Keith's daughter Linda has battled cancer twice.
So 2011, I had colon cancer.
And kidney cancer. They have what's called Lynch syndrome, marked by a gene that significantly increases their risk of getting colon and other types of cancer.
I mean, I might get cancers, but they'll be caught early, and that's what counts.
Both Keith and Linda are screened often to help find cancers early while they're still curable, and they both enrolled in the Colon Cancer Family Registry.
This is the largest scale registry in the entire world for colorectal cancer.
Mayo Clinic Dr. Pamela Sinecrope says data from this registry is used by many types of researchers worldwide.
We need ways to better understand the disease so we know what causes it, how we can prevent it, and how we can do a better job of treating people with colorectal cancer.
High-risk colon cancer patients and their families who enroll in the confidential registry give samples of blood, medical histories, and information about lifestyle choices such as smoking, exercise, and the type of foods they eat. Then they're followed over several years. Dr. Nora Lane Linder says keeping this registry funded is key to finding new ways to fight colon cancer.
The value of having a registry that goes on over time, particularly a family-based registry, where all of the relatives have a little bit increased risk because there's already been a colon cancer in the family, is that this group is probably more likely to reveal to researchers what those lifestyle or genetic factors are that made that family more likely to develop colon cancer.
Information that could help keep people like Linda and Keith, their families, and many others healthy and cancer-free. For Mayo Clinic News Network, I'm Vivian Williams. Mike McKenna is back in school. After years of working as a building contractor, severe epilepsy has him learning new skills and looking for a new job.
It changed my life completely. I haven't driven for, it's been about 7 years now.
Medications don't help his seizures.
They happen in my sleep about every 2 weeks for the big one. And then I have little small ones that happen a lot during the day.
Mike doesn't want surgery because removing the area of the brain where his seizures originate would be risky. Desperate for help, Mike enrolled in a study at Mayo Clinic where doctors implanted an electrical stimulation device into his brain.
It's called responsive neurostimulation. It's a device that's currently in research trials at this time.
Dr. Joseph Servant says the device is like a pacemaker for your brain. You see, an epileptic seizure is an abnormal electrical disturbance of the brain. The device is implanted under the skin and 4 electrodes are attached to the outer layers of your brain. The device monitors brain waves, and when it senses abnormal electrical activity, it fires electrical stimulation and stops the seizure.
It's almost like shocking the seizure away.
Because Mike's in a clinical trial that's testing the effectiveness and safety of the device, he wasn't initially told if his implant has been turned on yet. But he has high hopes for the technology.
I hope that I can have this thing control me even just a little bit better,
so he can regain control of his life. For Medical Edge, I'm Vivian Williams.
I want to get down 55 total pounds. And this is KROC AM 1340, our news talk station.
Brent Ackerman loves feeling lighter on his feet and more energetic. The operations manager of KROC Radio in Rochester, Minnesota also likes the fact his recent weight loss has greatly reduced the chance he'll be limping around the station studios in sandals again.
I apologize to people, but I said I have to do this or I can't even walk.
The sudden inflammation in Ackerman's big toe turned out to be a flare-up of gout, an experience he describes as agonizing.
Now, when I would sleep at night, I couldn't even have a bed sheet on top of my foot. It was that painful.
So it's the most common inflammatory arthritis in men. It's much less common in women, but women catch up after menopause.
Mayo Clinic rheumatologist Tim Baumgart says gout strikes 1 to 1.5% of Americans. It happens when excess uric acid forms crystals in the joints.
It's like pouring laundry detergent into a cup of water. If you surpass a certain threshold, it will start forming clumps. And then your immune system is, trying to get rid of those crystals, mounting a very violent inflammatory response.
Dr. Baumgart says a spike in reported gout cases is clearly tied to the obesity epidemic.
About 50% of gout is attributable to the overweight.
The risk of developing gout also increases with heavy consumption of fructose-sweetened soft drinks, red meat, and alcohol.
Alcohol is an important risk factor, especially beer. So if you drink 2 or more beers per day, your risk of getting gout approximately doubles.
Dr. Baumgart says a gout diagnosis should be confirmed with a blood test. Other tests include looking at the joint fluid for the gout crystals. Medications are generally very effective when monitored by a doctor to make sure uric acid levels are kept in check. For the Mayo Clinic News Network, I'm Dennis Stoda.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.